I don't want to go through this now and then in 20 years from now, be like, oh, sorry, you got to do it all over again because you lost all this bone.
In the consult I'm about to show you, the patient asked me a very significant question. Her main concern was, how long would her all-on-4 dental implants last if she decided to go ahead with the procedure? Now, that's actually a great question considering she was only 31 years old, but her teeth were actually in really bad condition. Now, she was actually the daughter of one of our past patients, and she'd seen what a great reaction that he had from his all-on-4. So in this video, I'll go over all the factors that will help lead your implants to being successful or a failure. So let's go to the consult.
Jesse, how are you doing? I'm Dr. Choi. Very nice to meet you.
Nice to meet you.
I obviously know your dad.
Yeah.
Yep. Okay, cool. Yeah, my dad.
Your
dad.
my dad.
Your dad did mention to me several months ago, and then he also told me again, like recently, about with your mouth.
Yeah.
And I had to see you. Wait, so what the heck happened now with your last dentist?
So 2016, 2017-ish, and I had all my teeth in my face at that point, but they were like decaying and bad.
Okay.
And I went to him, and he was gonna do my whole mouth, crowns, whatever it was that I needed, and it was gonna be like $20,000.
Okay.
So he does what he, grinds them down and does all that.
Okay.
And then he does send me to an oral surgeon, orthodontist, I'm not sure. And they do like a little consultation, and then I don't know, nothing ever came of
for
them.
implants or something?
Yeah.
Okay, got it.
So nothing ever came. I never saw that doctor again, but when I went back to that dentist, he was like, I'm so sorry. I should have never done this. These are going to fail in 2 years.
Oh.
He's like, the money that you've paid thus far is all you're going to pay. You don't owe me anything else.
Okay.
Sorry for your bad luck,
basically.
And I've been lucky because they haven't failed in 2 years. It's been, 6 or 7?
Front teeth. They did.
Yeah,
Okay.
Yeah. And this one was the one that failed recently, and it just came right out.
Just broke. Yep.
Yeah.
Okay.
And so, ever since then, just a lot of decay, a lot of teeth coming out, a lot of other external circumstances that's happened because of that. Okay. But now that these are failing, it's like I can't, I'm 30 years old, can't be walking around without front teeth.
Right.
So definitely need to do something.
Okay, cool. All right, so yes, I just on quick inspection of your x-rays, I definitely see something going on with your lateral incisor on your right side, your upper left canine, definitely something really big going on there. Obviously, you're having issues with your back teeth, and the teeth are broken down. You and Betty already had the discussion earlier, kind of like what, options we have going on. So I tell patients really what this comes down to is the good news is we have multiple options, right? So that goes from a regular denture to going to like a snap-on denture to going to an all-on-4, type of, prosthesis. So you have like multiple options. The biggest option, thing that comes into it also is like finances too.
Yeah.
Right. So where you are comfortably with in regards to like what, what decision you want to going ahead. Now, when I look at a case like this with you being so young, right? Sadly, now the front teeth, I do agree, like we do need to extract all your teeth, right? Now, the biggest concern, obviously, is if we headed to a denture. The good thing about dentures is most cost effective, but unfortunately, your, just kind of your lifestyle just is going to be completely changed, right?
Yeah.
Your ability to eat, also your confidence. You're going to be concerned about your denture moving around when you're talking or eating. Those are some of the things that are going to be compromised, right? Even if you use a lot of denture adhesive, it becomes difficult, especially for your lower, okay? A lower denture, every time you're talking or eating, your tongue moves. And when your tongue moves, the floor of the mouth moves, and your lower denture wants to do this. You could put all the denture adhesive you want on it. It still doesn't stay very well, right? An upper denture is a completely different story. An upper denture, if we make very well, then you can actually be pretty decently satisfied with it.
Okay.
But if you have a gag reflex or anything like that, then those patients may not be too comfortable. Okay, so that's, I'd say, was the biggest downside of it, right? Your taste of food gets impacted because, believe it or not, your roof of the mouth actually has taste buds on it also. So when you're eating something, you can actually taste, like some people say that when they have an upper denture, they can't taste food as well. So yeah, it's interesting, right? Now there's a middle solution. It's a snap-on denture. We're supposed to always go over your options. I don't like offering a snap-on denture because bang for your buck, it's not really worth it. And I've been practicing 14 years now, plus 3 years of residency. So I've been doing these for 17 years. And I really feel it's hard to meet patients' expectations with a snap-on denture.
Okay.
Even when we do it as well as we can, and the implants go in as perfectly, and all these things, it's just really hard to meet expectations. And even to just further illustrate that, I've had patients that have had snap-on dentures that they come back in a few years and they end up getting an all-on-4, something that's totally screwed in. Okay. Now, I don't probably have to explain too much to you about what an all-on-4 is because your dad has.
Yeah. Yeah.
Right? So it's really convenient because it's screwed in, right? So your implants are buried in the bone, but the actual teeth that we see are going to be the prosthesis that's screwed into your mouth, right? So, and the beautiful thing about it too is like that the added bonus is it also looks really nice. So when you smile, people think, yeah, you have veneers or something inside your mouth or your teeth are beautiful. Well, that's actually just the prosthesis.
Yeah.
Right? So the good news also with that is that, it's, your dental implants, it's going to retain bone. With you being so young, you don't want to lose all that bone over the years because then you'll get that facial collapse that you see like older grandmothers have and stuff like that. You don't want to do that because you're going to see accentuated wrinkles. There's going to be all these aesthetic things that are going to happen further on down the road. Now, obviously you don't have to worry about that right now, but I'm just talking about 15, 20 years from now, things that we want to avoid. Okay. Now, you did also mention to Betty that you guys were talking about, you were a little worried because you had some body scan done and they were talking to you about your bone density.
Yeah. So I don't want to go through this now and then in 20 years from now, be like, oh, sorry, you got to do it all over again because you lost all this bone or what the case may be. Like I was telling Betty, it was just body necessarily, not right here. I don't know if that's the same, if that counts, or like how an all-in-4 in the bone would last long-term wise.
So that's a very great question, right? Because you have to think about it differently than a 70-year-old patient does, right? And so, how old's your dad, by the way?
She was born in 1969, so 60.
Okay, got it. Well, somewhere in there. Okay, cool.
Yeah.
So, we have to think about your case very, very differently than him, right? And it's funny because Dr. Koo and I actually have had conversations about this. I'm 46. He's like 10 years younger than me, right? So the way that we have to kind of like think about things, how we would do things in our mouth, And so that's like, so let's break this down. How long a dental implant is going to last in your mouth? And I want to on a positive note, bone density. So bone density that I've seen, we do a lot of all. Okay. And so everybody's got different bone density.
Yeah.
In an ideal world, we want patients that have an abundance of bone, meaning we want thick bone, tall bone, and we want dense bone, right? We want a lot to work with. Because then if I could stick a big, fat, long implant in there in a bone that's dense, that's great, right? Now, again, it isn't an ideal world, surprise, surprise. So we see also a lot of other patients that we've seen very poor bone density, right? Meaning, I don't want to scare you here, but like literally we'll be drilling into the bone and we don't even have to power up the drill. It just literally, the drill just sinks into their bone. Oh, it's that soft, right? But the crazy thing is even those patients can get all-on-4 also, right? Now, they don't not like your dad where we got them that teeth that same day, right? Because his bone density was good. But some patients, if their bone is too soft, we have to place those implants, let that heal for about 4 months in a denture.
Yeah.
And then, because it's got to be undisturbed, and then when it's healed, I like to tell people, if you put a post into 2 foot of concrete, you can't start building on that, right? You can't start moving that around. You gotta wait for that concrete to set.
Yeah.
But once that concrete sets, then what we can do is we can start working with it, right? Similar to a foundation to the home, it's concrete. You gotta let it set before we start building on top of it, right?
Okay.
Now, so I just use that example. Even if you have soft bone, that would be the biggest disappointment you would have. You're just probably not gonna get your teeth that day.
Okay. But I would leave with something.
You would still leave with something.
Okay.
And then 4 months down the road, we can actually then screw in your teeth.
Okay.
But that's actually a very minority of cases. Very, very minority of cases. We see that maybe once a month, but once every other month. Okay. So the cool thing is we have ways to work around that. Now, another aspect of that is let's talk about long-term, right? Because how do we make sure that your implants are going to last over the long haul, right? So fundamental concepts to that is when we're placing your dental implants and we have your set of teeth, and I want to actually show you here. So when we have your set of teeth, this is actually a perfect example because this is the lower set of teeth, okay? Do you notice the access holes where we screw them in? They're very distributed all over the place. And even though you're chewing with your molars back here, what we're doing is we're placing the implant right underneath here. If I put an implant here and then your last tooth was here, that's not supported. And that's what we call a cantilever, okay? So let me give you a quick little example. So if I have legs on a table, like a rectangular dining table, okay? What you'll typically see is you'll see the legs at the corners, okay? So if you and I were to we're trying to screw something into the ceiling, we're okay, I don't have a ladder, so we're just gonna stand on top of the table. We're gonna both get on the end of the table, and we're gonna start screwing it in. And let's say that we started joking around, we started jumping up and down on this table. And let's say we do that because we have kids and they're doing that every day for 30 years.
Yeah.
Okay. That longevity of the table and where those legs are being attached to the underside of that table is going to be better off if we have them in the corners and have no cantilever versus if we put those legs away from the corner towards the center of the table.
Okay.
You know what I'm saying? Because now if they're more towards the center of the table, if you and I are jumping up and down on the edge, that area is not supported. And now those legs and the hardware, the bolts, the plates that are securing that leg to the table are now going to get more stress due to me and you jumping up and down and those legs being centered. So this is all like a physics and engineering thing, right? So that might sound like, well, that's a weird example, but that's actually exactly what's happened to your mouth.
Okay.
Because your implants are buried in your bone, but they're getting stressed, right? You're biting up and down, up and down, up and down, chewing on food. Also at nighttime, you're clenching your teeth, right? Granted, a lot of people do that, right? That's why their teeth even broke down.
Yeah.
And so how do we get something to last 50 years? If the average person passes away at 80 years old, we need to think that way, that you're going to, hopefully you go at least to 80.
Yeah.
Right? So what we always have to anticipate, well, if that's the case, how do we decrease the stress on the implant? Because one of the biggest issues that's going to cause an implant to fail over the long haul is too much stress on that implant. So there's different ways that we could decrease that stress on the implant. We can place the implants to where your back teeth are going to be. If you cluster them, and I hate to say it, but sometimes when people aren't as experienced placing the implants, if they cluster everything more towards the center, and I've seen cases like this. We actually released a video about this a few months ago. The surgeon, whoever did her implants 6 years ago down in Florida, clustered the implants way too close to the front. And so when she was biting with her back teeth, it was creating too much of a cantilever. And now she was having issues with her implants. The bad thing was about it was that she was still making payments on her teeth, and now she was having issues. So now imagine you spent that money, you thought you were going to be fine.
Yeah.
And 5, 6 years later, you're not having all these issues, right? So what you want to do is you have to engineer it properly, right? So you got to also, not only factor number one, you got to get those implants to where they need to be, right? Spraying the implants to where they need to be, just like the legs to the table. And then also what you want to do is you can even add more implants, because the more implants, if you have a certain amount of force coming down on more implants, then you can distribute that stress better, less force per implant.
Okay.
Right. So those are little nuances that you can take into account. And then also, if it's my mouth, what I would do is I would even add more bovine bone grafting in areas that you don't have the implants. Because the reason why that one's good is because you see less bone loss over time.
Okay.
Right. So Dr. Q and I, so we do a lot of that with front teeth implants, because when people smile, that's huge.
First thing you see,
right? You don't ever want a person to look at your tooth and be like, what's going on with that tooth? You don't want everyone to ever know that if you did have a missing tooth, that it was an implant, right? So there's things that what we do that's going to cause great long-term aesthetic outcomes and also long-term stability for the implant, right? Not just for the aesthetic component, but also for the long-term viability of the implant.
So even if, as I get older, if my bone density gets worse, it's not going to necessarily make it to the point where I'm going to have to get something done all over again.
Yeah, never say never.
Well,
but here's the reality. We've got patients in our this, we probably see one every other month that we do an All-on-4 on, but they'll be 27, 28 years old.
Yeah.
Why? They just, their teeth are in a similar situation like you.
Yeah.
So, it's, what are our options? People are like, man, I can't believe you're doing All-on-4 on 27-year-old. Like, what's our option? Right? Because it's either a denture where they're going to lose a ton of bone, and then even getting implants in them in the future is going to be even more difficult because they're going to lose bone, or it's going to do an All-on-4. But if you do something like an All-on-4, you got to be extremely careful about it.
Yeah.
Right? You got to do maybe a few more implants. You got to add some bovine bone grafting, and you got to make sure that everything is going to be as good as it can be, because again, we have to be prepared. I hate to say it, but a lot of people, the reality is a lot of people get excited when they go home and they see their smile, like, oh my God, it looks beautiful. But you have to look at it as if you're moving into a house. A new house can look beautiful, beautiful paint, drywall, beautiful kitchen and bathroom, but what's lurking behind those walls?
Yeah.
Right? You don't know what kind of plumbing issues or electrical issues, and you might not see those issues for a year, 2 years, 3 years, but if they were plumbing issues and now they're going down your foundation, we might have to tear out your flooring, your concrete foundation to be able to access some of those, and that's a damn nightmare.
Well, that's what that dentist, he was like, you're so young now, because you were so young, I wanted to keep your real tooth in your head and, the integrity of your tooth. And after I left that consultation, I was like, okay, but if it's gonna fail anyway, like who cares how old I am and if it's my real tooth or not? Like, why does that matter? And that's why I never went back to him after, you know, all that.
Yeah, so I agree in principle with him, but that's totally what we want to do. If you can save your teeth, fantastic. But what is the condition of the tooth and what is the prognosis of the tooth? Because if you're going to spend $20,000 and get 2 years out of them, then that money would be fantastic to reallocate towards another treatment option.
Exactly.
Right? At the same time, you don't want to do an all-on-4 if you could have gotten another 10, 15 years out of your teeth. You know what I'm saying? So I get it. And then also dentistry is very subjective, right?
Yeah.
And I always tell patients, we do tons of implants. So I want to be very aware of even the fact that I don't want to be implant happy and take tear every tooth out and turn it into an implant, right? So we have to go over legally. We have to go over all your options. If you could save a tooth, then save a tooth. But at the same time, you have to understand the prognosis of that tooth.
Exactly.
Right? Because then there's the other side of it. You completely do that patient a disservice, kind of like the situation you're in.
Yeah.
You know?
So that's another thing for me. So when I first had all of this done, and compared to now, my bite is totally different. Like I can tell, I can feel it. So with this, is it going to feel, I don't want to say different, but maybe like back to normal more or less? Or does it affect like your jaw when your bite changes like that?
Right.
Does that affect the implant? Things like that?
Right. So can I have you do me a favor? Like bite together and smell. Okay. So you have a little bit of overbite and overjet.
Which used to not be that way.
Okay. The cool thing about All-on-4 is you can literally take somebody with an overbite, an underbite, and make a lot of these modifications with these teeth to give you that ideal bite, right? And so now there's even what we call your VDO. You know, when we put a set of teeth in, like we don't want to make it too tall. We don't want to make it too short. If it's too tall, then, you know, it's going to be like a little weird on your joint. It's going to like even be a strain in your mouth. And if it's too short, then you're going to see facial collapse, right? So there's like a lot of that affects everything. So again, this is where they shine to making sure that everything is ideal as possible.
So if you could put it in, because I was joking with the parents, I was like, you know what wouldn't fail? Dentures wouldn't fail. Yeah. But you also told my dad, you were like, if I put dentures in your mouth, you're going to hate me in a couple months because it's just big plastic things in your mouth. Yeah. So me being 31, so if you could put a percentage on it just to make me feel better, 20 years from now, bone density and everything like that, is there like a 2%, 5%, 10% chance that I'm going to need to have something else redone or more work, or if it, heaven forbid, fails, or you know what I mean?
Right.
Like if I would need something.
Right. So what I like to bring up as like so we're talking about long-term prognosis of All-on-4, right? And so that's a really great question because when you heard me saying this earlier, it was invented in 98 in Portugal, this whole protocol, right? Now we've been using implants decades longer than that, but you know, when we have to consider basically the long-term of a dental implant, you know, I've been practicing, you know, like this is again my 14th year of practice, but what's kind of cool is like when I sit there and I try to evaluate, okay, well, how long is this implant, whether it's a molar or a front tooth, going to last on somebody? Is like we have to evaluate like bone loss, okay? Because you can actually see like if you can get through that first 4 months of having that dental implant within your mouth, you'll know whether that implant is going to like succeed or fail over the long haul. Because what you typically see is you'll see a little bit of bone loss happening around the top of the implant, and it gets progressively worse over time. Okay. So the cool thing about that also is we have like special lasers and all these things that you can use to help stop that and detoxify the implant, because why that may be happening is either bacteria or because it's getting too much of a load, right? Too much force on that implant. And like I said earlier, one of the ways that we're going to distribute and reduce that force is by whether placing more implants, you know? But also, if you were to see whether that patient was having bone loss or not, you could also use those special types of lasers to help prevent those issues. Okay. It's kind of cool because we also in this office have different types of lasers. You know, we have a erbium YAG laser, which I use specifically for these implant issues. We also have an ND YAG laser, which we use for periodontics. So there's different lasers for these types of like things that are going on. But actually, let me also take a look at your bone density real quick here. So whenever we do like a lot of, you know, All-on-4 and then we look at 3D scans and stuff like that, we can really get a good sense of your bone density, but your bone density looks pretty solid.
Okay, good.
Yeah. So
that's definitely reassuring.
No, it's definitely really good. And what's really cool is if I even like kind of, we can tell by how much like white there is, you know, and then we actually even have like this bone density thing, and you could see,
okay,
you know, the heat map Like the bluer mean more dense. So I mean, your bone's pretty solid.
Okay, good.
Yeah, you're nowhere near some of those cases that we see where the bone is insanely soft. You know.
Okay.
So that's good news. Good.
Yeah. No. Absolutely. Yeah. I'm just panicked.
No, I totally agree. I'm like, my mindset is always like prepare for the worst.
Yeah.
Right.
Yeah.
So I own North Texas Dental Surgery. I tell patients like, listen, I warranty your product also. And the other thing is that like, if you have issues, then I'm going to have issues. Right. If you have issues, you need more surgeries, more appointments here. And that's not good for me either.
Right.
You know? So number one, that's like a business thing. But number two, also, I always tell patients like, listen, I'm going to do for you what I would do in my mouth. You know, and even if I was 46 years old, then, I'm 46 from the same. If I'm 46 years old and I'm going to get, if I was to get All-on-4 or something like that, then then we are talking in my mouth. Personally, I'm doing at least 6 implants.
Okay.
If we have space, maybe we can even do more. I'm going to do again the bovine bone grafting everywhere to retain as much bone. I'm like super anal about things. I don't want to have problems. I don't want to have problems.
Yeah.
And like, even when we do our surgeries, when we're placing our implants, we already are having contingency plans that if this were to happen, then what would we do? And that's kind of like how we have to think about these things.
Okay. And then you think that all the real teeth I have left on the bottom definitely need to come out?
They're too broken down.
Yeah.
They need to come out.
Yeah.
You can even see the infections in the bone because you see that darkness that's developing around those.
Oh, is that what that is?
Yeah, those are infections in your bone due to the infections coming from the teeth.
Okay. Yeah. And I was like, if he can save your bottom teeth, I was like, Mom, look at my bottom teeth. Like, I'm pretty sure that they just need to all, like my dad had, just come out and go from there.
Yeah. Now, I'd have to look at your dad's x-rays again to see how bad they were, but yeah. Absolutely.
His was, because he hadn't been, before he hadn't been to a dentist in like 30, 40 years. So he was like terrified.
Yeah.
So yeah, his were probably worse than what I got going on. Yeah. So, but it's, I don't think I've ever seen my dad smile, especially not with his teeth. He's always had a mustache and he doesn't smile.
Yeah.
He definitely did it, I think, now because he's a granddad because of my daughter.
Yeah.
And it's nice to see him smile and be able to eat things and,
Yeah.
So I'm like jealous. I'm like, well, I want that.
Okay. Any other questions?
No, I definitely need to think about it, and take everything home and, read over it. And overanalyze.
Cool.
Things, but...
And then if you have any other questions, come let us know, okay?
Okay.
All right. Rate this video.
So...
Yeah, no problem.